Hello everyone, welcome to our channel FMT Forensic, and today we are going to discuss about how to describe sharp injuries. And as you know, commonly encountered sharp injuries are stab wound, incised wound and self-inflicted incised wound. So let's see how to describe them. Incised wound is caused by sharp objects like knife, razor, surgical blade and broken glass etc. And how to describe an incised wound: for example, an incised wound of size 5 into 0.25 centimeter over right arm lateral aspect, and it is muscle deep and present obliquely with clean, clear-cut, regular margins and no active bleeding, and shirt worn by the patient torn adjacent to the injury. A stab wound is caused by sharp pointed objects like a knife, ice pick, or it can be caused by blunt pointed objects like screwdriver or fork, and a stab wound can be accidental or intentional. How to describe a stab wound? For example, a stab wound of size 2 into 0.25 centimeter with clean, clear-cut, regular margins, and depth cannot be determined as probing was not done, and active bleeding present over left lumbar region, and advised surgery opinion, and shirt worn by the patient torn adjacent to the injury. Self-inflicted incised wound. Usually there are multiple parallel non-linear superficial cut marks that are present over easily accessible body parts like forearms. And how to describe self-inflicted incised wound? So we can describe it like, for example, multiple non-linear parallel superficial incised wounds of varying length over ventral aspect of left forearm, and active bleeding present, and hesitation mark present, and possibility of self-infliction cannot be ruled out, or possible self-inflicted incised wounds. And lastly, it is very important to examine the clothes of the patient. If the clothes adjacent to the injury torn, then kindly circle that cut mark and seal it in a pulinda and hand it over to the investigating officer.